Mm. All right, welcome to the live fireside chat with Theresa Hernandez. My name is Becca Kyle. I am a certified functional diagnostic nutrition practitioner and board certified holistic health practitioner. And I support professionals and entrepreneurs in reversing burnout symptoms so they can stop wasting time, energy, and money and start living vibrant lives because they don't have to worry about solving a health problem. So we do it strategically. And I am here with the amazing, the incredible, my personal go-to HRT hero, Theresa Hernandez. And I'm going to read her little bio here. If I can find it. Okay, let's see. Theresa Hernandez is board certified in family practice, functional medicine, functional endocrinology, bioidentical hormone replacement. Thank you for that. And cardiovascular disease management. She is a family nurse practitioner that centers her practice around all aspects of the patient, from a detailed health history connecting vague symptoms to creating an individualized care plan specifically for each patient. From the first time you meet, you will experience her talent for finding the root cause of your diagnosis with friendly conversation and humor. She is fun, all while in a comfortable environment. Ms. Hernandez is recognized in her community as the go-to specialist in very challenging cases. She's also the mother of 3 children, ages 4 to 11, who keep her on her toes and fill her heart with love. So I'm excited for this conversation, and I think I was already thinking we should like do it semi-regularly, like every other month or something, because I think that we're just going to barely get into some of these topics today because we could, if you're like me, I love rabbit trails and we can kind of go down a million rabbit trails every 5 minutes. So if you are on with us right now, I want this to be a legit conversation. So feel free to turn your video on. We love seeing people's faces. This is really not about myself and Theresa. This is about everyone here who's watching, because we want these types of conversations to be more common. We want people to be discussing these things. We want this to be active topics of interest because they're so important to us. And we know that when people have a better understanding of the sick care model versus wellness care, what options are out there, all the things that people get healthier faster, which is both of our goals. We want, I know it's my personal goal to make the world a better place, and that has to start with better health, because when you feel better, you can do better. All right. So I'm so glad you're here with me. Like I said, Theresa is the lovely human who helps me with my bioidentical progesterone, which is a lovely thing. We'll have to talk about that later. But so Theresa, I would just love to start off by asking you, what's your take on the sickness care model versus the wellness care model? And like, what do you see helping people get healthier more quickly?
I just want to say thank you, Becca, so much. And I appreciate what you do for your clients, our community, and helping me bring my voice out there too. You are just as important as anyone else in this realm, in this community. You are so driven every day to just put good word out there and to introduce maybe newer practitioners to the public. I told my husband this morning, it is so easy now, especially in our area, to find anyone, someone. There's a lot of us out there to help once a year, twice a year, to check in on ourselves, which no mother does. That's also part of my goal, is to get us moms out there checking on ourselves, right?
Yeah.
So you bring up a good point about going to see the doctor when you are sick, if that is something acute to you. To me, that's the red flag. You've already crossed the finish line. That is your symptom. You are already dealing with some sort of disease. If it's chronic, right? Like I'm thinking high blood pressure or a kidney stone, a urinary tract infection, a respiratory infection, you're going for treatment of some cause, something that's been festering for a while.
Yeah.
You and I want to go back a little bit more. And I tell my kids this too. Can we work on prevention of that? That's even for cold, flu, bronchitis, all the things that I just listed, right? My clients and your clients are focused on prevention. How can I prevent that from being a thing. And sometimes you can, and sometimes you can't. But when you think of the whole wellness picture, there's so much to do. So those are two different reasons to see someone in our area.
Yeah, absolutely. And I find that when people are solely focused on the sickness care, it's such a reactive perspective. Like, oh, I got these symptoms and I have to go to the doctor. Oh, I've got a fever, I've got to go to the
And there's a
doctor.
different treatment for that too.
Yeah.
And that's so, yeah, there's certain people that like to go for diagnosis and then line up for treatment. And that usually involves a drug. If we
Mhm.
want to do something differently, it's a whole different approach. But especially after COVID, a lot of people are getting it.
Yeah. I think that's one thing that that whole extravaganza really highlighted is that people, for the first time maybe ever, or at least in
Yes.
a long time, were forced into really taking a look at their health for the first time, of like really having that conversation of like, well, what is my lifestyle? How susceptible am I to germs and illness and viruses? Am I, so stressed out that my immune system has been hijacked? What have
Yes.
I been exposed to? What's filling up my stress bucket? People who know me or work with me or know me personally know that I love bucket analogies because they're simple
Mhm.
and they're easy. We all have this stress bucket, and that could be filled up with emotional stressors, relationships, or a job you hate, or fear of what's
Good or
happening,
bad, good
right?
or bad
Yeah.
stress. Yes.
Yeah. So the good stress we like, like if you're like trying something new, or you're going on a first date, or you're traveling somewhere new, that's good stress. It just maybe
Yes.
makes your heart beat a little bit faster and gets you all excited. But I think so many people are under years of chronic stress.
Yes.
And our bodies just weren't designed to handle it. We are
No.
meant to, deal with an acute stressor and come back into balance, deal with an acute stressor and come back to balance. But
Yeah.
so many of us are dealing with acute stressors plus the chronic stress, whether it's emotional or, for me, I just had a physical stressor with my shoulder injury. My personal specialties, and I think you do a lot of this too, is the biochemical stressors, hormone imbalances, leaky gut, nutrient deficiencies, pathogens. What's driving inflammation? What is your toxic burden? That's what kind of lights me up and gets me all nerdy and excited. But while we can't always make super fast progress in like a relationship necessarily, now you can just kick those energy vampires to a curb. But what I love about working on those biochemical stressors is if you know what they are, you tend to be able to make faster progress in them than some of the more emotional, job relationship type stressors. Because we can always quit the job that we don't like immediately. It'd be nice. And so, when we think about sickness care versus wellness care, that sickness care is like it's just it's such a reactive system. You're already at that diagnosed disease, place, and the wellness care is that preventative. If you so many of people that I talk to, they're so used to feeling bad, fatigue,
Yes.
headaches, insomnia, whatever, that they forget that they're not supposed to feel bad all the time, or it
Yes.
becomes normal for them.
Or
And
they don't seek help because they think there's no change.
yeah,
Like, please emphasize that too.
yeah.
Yeah, that is all reversible.
Yeah. And if you address something before you get to that diagnosed disease condition, how much easier is it to move the needle
Yeah.
into balance? And I think so many people just get used to feeling bad.
Yeah.
Or the best thing I hear is, well, I'm over 40. I'm supposed to be tired.
Yeah,
I'm
no.
supposed to be overweight. I'm supposed to be XYZ. And I'm like, that is the biggest line of BS I've ever heard in my life. So
Yeah.
so what are some of the most common like myths you come across when it comes to sickness care versus wellness care versus symptoms? Like what do you hear a lot and kind of in just the community or just in your practice that you have to kind of reframe for people?
Yeah, that's a good question. I mean, I like to break it into categories, right? So like anything about the gut, nutrition doesn't matter, what I eat doesn't matter. I mean, their physicians are telling them that, whether they have cancer or, I mean, that is huge. Of course, what you put in your fuel tank matters. Little things, then, like, let's think of social, emotional, or mental health. Maybe meditation, 10 minutes. How could that matter? how could changing my lifestyle matter? It's huge,
Yeah.
huge things we can do. Um,
I have two
and
clients who came to me already diagnosed with Hashimoto's, and they both told me their endocrinologist, two separate people living in separate places. They both separately told me their endocrinologist said that their nutrition would not impact their autoimmune issues at all.
let that number one. And number two, I think what a lot of women need to hear is, I got another one today too, this ANA. Every single endocrinologist will tell you that is not reversible. That is not true. Point blank. I don't care if you have, there's levels to it, right? There's low ANA titers, there's higher ANA titers, and I guess I should say, meaning autoimmune. Your
Mm-hmm.
body is attacking itself. That is reversible. That is not a genetic condition you were born with. Somehow that came to be. You and I will help the patient figure out, and nutrition is part of that. Gut healing is part of that. But that is probably, I'll say, the hugest myth, medical myth. ANA or autoimmune disease is reversible.
Absolutely. I had a client 2 years ago whose doctor let her self medicate herself from severe hypothyroid into severe hyperthyroid, never tested her antibodies, which were, she tested with me, they were through the roof. And she had mold toxicity, she had blastocystis hominis, which is a parasite. Her minerals were like completely destroyed. And we didn't treat her Hashimoto's, because I don't treat disease. What we did is try to restore the body back into balance,
Yes.
working non-specifically, working on restoring function in every cell tissue in the body. And guess what? 6 months after we started working together, all of her, like both of her
Reversed.
autoimmune antibodies were normal, you
There is
know?
a reason the body is attacking itself. Like
Yeah.
you said, you have to get, and it's not hard. It's not a couple visits, a lot of conversation. Is your body not worth it?
Yeah.
I can't stand when I hear people, I'm living with autoimmune disease and there's not, that is so not true. There is so much to be done. So yeah, I'm glad we brought that up.
Absolutely. And it's just something that when we think of anything autoimmune, like you said, diet, stress level, nutrient
Yes.
deficiencies. My favorite question to ask is why. So, okay, you
Yes.
have an autoimmune, why? What's driving that? What's triggering it? Is it toxic burden? Is it pathogens? What's going on? Is your gut just a hot mess because of high
Yes.
stress, or
Yes.
or because you have hormone imbalance, or
Yes.
what's going on to impact the gut? And I think you believe is what I believe is that your gut impacts everything, your brain,
100%.
your
Yes.
hormones, your
Yes.
energy, your
Yes.
pain levels. It
Yes.
impacts everything. So what's the most common like gut symptom you see people coming in with? Like, is it bloating, IBS, constipation, reflux? What do you see really commonly
Yeah,
in
kind
your
of all that,
practice?
like IBS, right? And actually, even Austin Gastro and all the gastroenterologists out there are finally saying that IBS is a symptom of SIBO, just a dysbiosis. Too many bad, over the good. Let's
Yeah.
just keep it simple like that. But yeah, gas, bloating, constipation, diarrhea, um, and little children too.
Mhm.
Pain, they don't want to eat. Um, uh, Low appetite. These things need to be addressed and can easily, I'll just say, the gut lining, refreshes every 2 months. If you can devote 2 months to resetting the gut, you'll be back on track. 60 days. I mean, it's
Yeah.
just to let people know these are quick things to do.
Yeah. I mean,
And
time's going to pass
even if you've been
anyway.
suffering 5 years, I
Yeah.
don't care. 2 months.
Yeah. I mean, time's gonna move, time's gonna go. And
Yes.
like I just think about the last 2 months, I'm like, where did they go?
Yes.
What so
You're
much
either
can
going to
change.
start moving in the right direction or
Mhm.
you're just going to kind of keep standing still.
Yeah,
And yeah, a lack of stomach acid, perhaps. That's what I see often.
yeah,
Sometimes you don't have to change your diet. You can make some modifications. Yeah, I'm not going to tell everyone gluten-free, dairy-free, avoid. That is nutrient depleting. We cannot do that. We cannot create a food disorder. Food is social, but we can make small adjustments to optimize what you are ingesting, right? Make sure everything you're eating is good and well and nourishing to you. But yeah, to treat those gut symptoms, easy.
Yeah, something interesting that I see, I mostly work with women, but I also work with some men and some children. Some it's usually like whole families, you know.
Mm-hmm.
But I had a pediatric client, and I'm seeing this kind of a little bit more with my kiddos who are kind of failing to thrive. Like they don't want to eat, they're not hungry, they have stomach pain, and I'm seeing a lot of mold toxicity with them, which can then send them into ketosis. And then why do people go into ketosis on purpose? To lose weight, right? So then they're not eating, they're going into ketosis, and then you eradicate the fungal overgrowth in their gut. And guess what they do? They start eating again. And it's like, you know, I think that sometimes we create these in our mind just as parents, like something's really terribly wrong in there. It's just, it's
Yeah.
awful, and it's this lifelong condition. But so often it's like it's basic, but you don't necessarily know what it is. And so that's one thing I love about the functional lab work, or any lab work really, is that I don't believe that there's a one size fits all anything, and that we have to address each person, whether you're 5 or 50, you know, as an
Yes.
individual. And then, you know, and then we can really dive into so many things, even just with like, I really detailed intake forms. You probably do too, you know, or just those conversations of, you know, symptom presentation and connecting the dots. And, you know, so many, like this one kiddo's doctor was like, well, just give him Miralax for the rest of his life. I'm like,
You
well,
know, there's a
no.
Facebook page on Miralax. You hear how bad Miralax is with kind of automotive chemicals in there. I
Yeah,
had one parent, I did, and she had no idea. And I said, no mom guilt, but this is all education,
yeah,
right? This is all
absolutely.
learning. And as bad as maybe you think you've done, it is all reversible. Our bodies are so forgivable and ultimately changing all the time.
Yeah,
All of this can be changed.
absolutely. Yeah. And I think people feel overwhelmed and they feel stuck because for years, sometimes decades, they have
And they've been
purposely
told,
tried
yeah,
to get help, and they're not getting help, or they're not believed. I mean, I literally had a female client a couple years ago who was not functioning, could not get off the couch, like just not working. And the advice her doctor gave her was to just get your husband to help with the dishes a little bit more often. I'm like, how does
that's
that
so
help
sad.
anyone? That is like, it's just devastating. And so people, I think especially women, are underserved in the traditional medical community.
Yes,
They're told it's anxiety, whereas if a man and a
yes,
woman went into the hospital with the same exact symptoms, the man would get actually tested for the thing, and the woman would
yes.
be like, it's your just anxiety, you're stressed.
Psychosocial, yes,
Yeah.
right.
And so I think so many women with the overwhelm, and they're like, well, nobody can help me. I'm beyond help. And I like to
Yes.
say, it's like, you just haven't found the right person yet. And so that's
Totally.
why I
That's
like to,
yes.
you know, bring people like you. You know, I blast myself all over social media, you know, all the time. But I mean, I see people on just, you know, local Facebook groups saying like, does anyone know of who has a doctor, who has a functional medicine practitioner? And I'm always like, check out Theresa Hernandez, you know, because I think it's one of my main jobs and goals is to take people from a place of not knowing to knowing. You know, I can't
Yes.
tell you how many of my clients are like, I didn't know somebody like you existed. You know,
Mhm.
if somebody doesn't know that you exist, how can they access your care? How can they access your support? And I think, you know, if I could tell, especially the women listening to this, is like, if you can just do one thing, is just don't give up.
Yes.
Keep
A
looking,
hundred percent. You
keep,
have
you know,
not found that one person. You continue because I said you would do the same thing for your husband or your
mhm.
children. You have to do the same thing for yourself.
Yeah, absolutely. So I have a question because I get asked this when I refer people to you. And so I do a lot of work with like adrenals and hormones. And so, you know, I cannot, it's not in my scope of practice to prescribe something or to prescribe anything medication wise, but I have some clients who are kind of, you know, interested potentially in, you know, hormone replacement therapy and just different things. So, but the number one question I get asked when I refer out to Theresa is, does she take insurance? And so I'm just going to put that question over to you, and you can just tell us about your perspective on that and what the actual answer to that question is and why you do what you do the way you do it.
Yeah, insurance. And I used to work in the family practice, normal insurance model, and we were scheduled every 10 to 15 minutes. That is what insurance pays. A 10 to 15-minute visit. They are looking at codes. It is really a black and white system, right? And those people are getting what I believe is failed medicine. You go in there, you've been treated, if the pill doesn't work, they switch to another pill. They're always going to switch to another pill, give you more, maybe a longer period of time, or like we just addressed, they're going to say there's nothing else I can do for you.
Mhm.
Um, ensure in my practice, I meet with patients for 30 minutes, 60 minutes. We talk things out to get to the
Mhm.
root of the problem. It's just probably 90% conversation and maybe
Yeah.
10% examination. And sometimes the patient knows the problem. They just need me to validate that their thoughts and their feelings and their beliefs are true.
Yeah.
So we have that conversation and we develop a plan of treatment too. So it sounds like a long time. This is not a traditional visit. But my patients are not seeing me that often. Twice a year, perhaps, is I'd say that's average. Every 6 months, we check labs. But insurance, bottom line, will not pay for any visit with any practitioner outside of that 10 or 15-minute standard, and it's treatment visit. Remember, we're doing prevention.
Yeah.
Insurance does also not want to pay for any preventive visits. So I have to teach my patients, where are you at in your journey and how motivated are you for a change? If
Mhm.
you are frustrated with the medical system, and most are, the 10-minute visit has brought them no help,
Yeah.
that you need to look elsewhere. Try someone one time. I say you have to try someone else one time. I can give you a super bill. That is a medical receipt, I call it.
Mhm.
And you can take that receipt to the insurance and ask them for reimbursement. Sometimes they will give you 25, 50%. You'll get something back because they would never cover 100. But we keep our rates affordable for that reason. I don't just treat in Lakeway, Bee Cave area. I see patients all throughout the state of Texas, and I know you do too.
Yeah.
So I have plenty of people down south by the Mexico border that need just as much help as in our neighborhood. So see anyone, see me, see Becca, see someone that you know that is trained in functional medicine. Step outside of your insurance. I guarantee it will be cheaper, more affordable than your monthly premium, than your deductible. And yes, that includes blood work. Blood work, you work with a practitioner that is functionally certified. They give us cheaper rates.
Mhm.
It's cheaper than even cash price. So you can either use your insurance if you've met your deductible on your blood work. You can pay cash price, which is usually in the couple $100 to $200 range for a full panel of blood. And then you
I'm
pay
going to
for the,
stop you there for a second because
yeah,
I, my clients, when they first, book with me, especially ones that do these long-term programs, because they just need a deeper level of support, I'll be like, do you have any recent blood work? I'd love to check it out. And then, something like, well, like the Dutch test, which is a adrenal hormone panel, there's patterns on there that can point to some thyroid dysfunction, for example. And I'll say, oh, do you have any thyroid markers? I'm like, oh yeah, I got this thyroid panel done. And it's literally just TSH. I'm like,
yeah,
so one of the things I have to help teach people to do is ask for full panels. TSH
yes,
doesn't tell the whole story, and like reverse
yes.
T3 is almost never tested. So I see like partial panels all the time for thyroid, iron. They'll just do
Yes.
ferritin. I'm like, that doesn't tell the
And
full
that is, and
story.
isn't that the number one reason why they say, well, I went to my doctor and they said everything was fine.
Mhm.
And I said, because they didn't check everything. And a lot of people assume that just because they go give it, well, yeah, a patient was like, well, what's my blood tape? I don't know. I didn't test for that.
Yeah,
You have to test for certain things to find those answers.
yeah.
So you're right. They will test for what they can drug you for.
Mhm.
If there's a drug, then they'll test you. If
Yep.
there's not a drug, they're not interested in checking that, but
Mhm.
those things can be changed in other ways.
Yeah. Yeah. I mean, like if you're someone that suffers with chronic, headaches, guess what? It's not a Tylenol deficiency.
Yeah.
I mean,
Yeah.
it's not a, Botox in your skull deficiency.
Mhm.
I mean, there's something driving that. I see something like chronic migraines, especially with my clients that have high histamine issues that are then often driven by like estrogen dominance or fungal overgrowth or bacterial overgrowth in the gut. Again, it's like the headaches aren't the problem. They're the
Yes.
results of the
What is
problem.
the,
So if all you're
yes,
trying to do is band-aid the headaches, let's stop the headaches with the medication. And I'm not anti-medication, but if
totally
all you're
agreed.
doing is band-aiding a symptom and you're not ever diving into, well, why do you have that symptom in the first place? Most of my clients are like, I don't want to be on this forever. I'm on this medication. I don't want to be on like reflux. So many people are on meds for reflux, which will mess up your bones and all kinds of things. And what I see clinically all the time is like 100% across the board is my clients that are on a medication for reflux have H. pylori, which for those of you who are listening, it's a bacteria in the gut that can mess up your stomach acid. And then you end up with, things like reflux and heartburn. But, we get rid of H. pylori and a simple 60-day
Mhm.
gut fixing protocol. And guess what happens with the reflux? It goes away, and I think that so many more people are waking up to the idea that this type of care is available, and there are people who actually care, and there are people who actually will spend time with you, and then they're not just in and out, in and out, in and out, in and out. And I think that again, I have had my life saved by traditional medicine. I think it's great to save your life, to fix your broken arm. Last year, my son got bitten by a copperhead. Like that was a medical intervention. But so many people aren't doing anything about their health until they have to have that medical intervention.
Yes.
And I think that it's a really cool thing that in just the last couple of years, people are like, oh, there's other options. Oh,
Yes.
I can address this holistically, lifestyle, stress reduction. It's just really just such a lovely thing. So Theresa and I were talking before we hit record on this call here about some of our favorite just habits that are free that can make such a huge difference in energy levels, in mood, and sleep, and brain function. So one of my, I'll give like my top three that I love. One is sunlight. I was telling her that I am solar powered. I would never make it in the Pacific Northwest,
I
but
love that. Yeah.
oh my gosh. And then, so I like to go on early morning walks, even if it's just 20 minutes. It's all I have time for because it gets you moving. It gets you outside in nature, which is so important for all things nervous system. And then there are certain spectrums in the sunrise and sunset light that are so healing. Certain spectrums of light that are so healing for the endocrine system. So, if your hormones are not in balance, if you have chronic fatigue, if you think your adrenals are shot, get sunlight and get that sunrise or sunset light. Our bodies were designed and created to
Yeah.
watch the sunrise and sunset. But what we are is we're under fluorescent or artificial lighting all dang day, and we're not getting the healing spectrums of light. So one of the I hear my clients like, I don't have time. I have a long commute. I have to drive. Crack your windows in your
Yes.
car. Light bounces. Get
Yeah.
that sunlight. And then one of my other favorites is I call it white space. It's taking 10 minutes midday or mid-morning or mid-afternoon or whenever, and just no distractions, no phone, no technology, ideally outside, ideally, somewhere with sunlight, where you can hear nature if you have access to nature. And I know not everyone in the nation has, accessible nature places. In this community, we have lots of nature, thank goodness. But it's just sitting and being for 10 minutes and breathing and literally paying attention, like what does the breeze feel like on my skin? What sounds do I hear? And just letting your nervous system kind of reset a little bit. It doesn't cost any money. Most people hear self-care and they're like, I don't have $1,000 in a day to spend at
No.
the spa. Like, that's not self-care. I mean,
No.
that's great. I would love a day at the spa, but self-care to me is what are the daily things you do every day? So what are your daily habits
Right.
to really create that optimal health? So for me, it's white space, it's walking, it's sunlight, it's nature. So what are some of your like favorite habits that you like to do and or coach people to do for themselves?
Yes, I love kindness and gratitude. I am
Mhm.
always teaching my kids. I mean, doesn't that put you in a good mood? Like, settle yourself, kindness to everyone. You don't know their situation. Kindness and gratitude towards yourself, towards anyone else you come in contact with. And sleep. Sleep is my other huge, like either just resting, it doesn't always have to be a nap, but resting and sleep. I call it
Mhm.
restorative sleep,
Yeah.
not this going to bed and watching TV or getting up in the middle of the night. And again, that's where a lot, just as popular as you said, acid reflux is, insomnia is
Yeah.
huge. No one is sleeping and no one is
Mhm.
sleeping well.
Yeah.
So, yeah, lots of things to do there, right? We need our sleep if we're going to restore our immune system, our adrenals, our stress response. Sleep is
Yeah.
huge.
If you're not sleeping, you're not healing. And
No.
my clients that come to me wanting to lose weight and they just can't, they've tried things. I'm like, well, how are you sleeping? If you're not sleeping, you're not going to lose that weight
No.
either.
No.
And so many people say, I think I'm sleeping, but I wake up tired. I don't ever wake up refreshed. I don't ever wake up restored. I'm like, well, then you're not getting quality
Yeah, you're
sleep.
not
Even if
sleeping.
you're in bed the right amount of hours,
Yeah.
you have to, get into that restorative sleep or your health is not going to get to where you want it to go. So, like one of my things I have ever since I was a child, I've had sensory issues. And one of my biggest hacks for getting good sleep is a weighted blanket. It's a one-time investment. They don't have to be super expensive. And for me, it is like I know there's a huge difference in my quality of sleep if I have that weighted blanket on me or not. And not everyone needs a weighted blanket, but making your room cool, making it dark, using white
Yes.
noise, getting the weighted blanket. Like, what are some of your favorite tips and tricks and hacks
Oh,
for
my
getting a good
neighbor and
night's
I
sleep?
are always especially now that my kids are a little older, but I am blocking my eyes, blocking my ears. I mean, I'm so too much, right? I need to shut all of that down. And then lately, I've just been listening to a meditative something or
Mm-hmm.
other, and sometimes at first I thought it would be too engaging for me, but by the end, I'm usually falling asleep. And I like little things, I kind of call that my treat. Like if
Mm-hmm.
I'm doing something for myself, I it's we don't do a lot of that. So
Mm-hmm.
something like that, all of my adrenal support, all of my meditation or even exercise, like anything I do, try to do for myself as a little treat. So I like that at night too.
Yeah. Well, and then when you say treat to me, that's again like that's what self-care really is. And
Yes.
it's coping. Self-care really is how are you coping? Coping can be
And
positive or
recognizing,
negative.
hoping, and then doing. And it's not like, even I was brought up that self-care is
Selfish.
selfish. Yeah, my
Mm,
mom, oh my God, we would not, I mean, you would not, first of all, she was told never to speak up at the doctor's office, which is silly, but that's how it was,
yeah.
let alone do something to take care of yourself. So yeah, we
Mm.
have to break that trend too.
Well, and I think it is definitely a generational thing, and
Yeah.
that we as women, have to. I think people our age at this point. I'm 45. I'll just put that out there. I don't care.
Mhm.
I think women our age are finally being like, no, I am drawing a line in the sand.
Yes.
I am not going to live this way anymore.
Oh, I
I
verbally tell my kids this.
Yeah, like
Yes, yes.
I am not going to just be miserable and let my health tank and like whatever because I am worth it. I have value.
Yes.
And to me, especially as a mom, I have three boys.
Mhm.
Teresa has a gaggle of children. Actually got to see you at a kid event last night, which was really fun. Like as moms, it can feel like, well, I don't have time or I need to be spending that money or that time on my kids or whatever. But
No.
there's that stupid saying that I hate, like, you have to pour out of yourselves to serve others. And that is a lie.
Yeah.
We are not pitchers to pour out of. We are serving bowls.
Right. Someone said
We're
we are
serving
human
bowls.
beings, not human
Yeah.
doings. Yes.
And self-care or how you
Yes.
choose to cope is literally just filling your bowl with rest and
Yes.
play, with
We
nourishment,
have
with
to,
whatever.
or we
Yeah,
cannot take care of our family.
no.
We
And
have
we
to.
we have to serve people from the overflow,
Yes.
not
Yes.
pouring out. We don't pour out.
Yes.
We fill ourselves up and then we serve from the overflow. One thing
100%.
that I struggled with personally is I never necessarily felt that it was selfish, but I felt that I had to earn it. Like I can't participate in self-care until my kitchen is clean, until my laundry is folded, until I sent those emails off or whatever. And self-care is not something that you have to earn. It's not something that you deserve.
Yeah.
It is your right as a human being to take care of yourself. And
Yes.
it's not meant to, like your to-do list isn't meant to be drained down to zero. I learned this from Lindley Gentile, one of my favorite local women's coaches and licensed therapists, and that your to-do list is not meant to be drained down to zero. You are supposed to interweave your to-do list with your self-care list. And that you should have some intermix throughout the day. So my morning walk is self-care. My sunlight is self-care. My grounding is self-care. My being in nature is self-care. Me having a 5-minute ridiculous text conversation with my best friend is self-care, right? And that if you don't, as a busy mom, especially if you are a working mom,
I
or
was
or
going to
like
say let's address that really
yeah,
quick because there's so many. I have a lot of friends and a lot of patients that, well, you're living the life and you have time to do all of this, and I'm glad you have this modified schedule. But I work 9 to 5, and and then they go through all their lists of all the, and I said, you know what? I have had to teach myself. You've been there. I've been there.
mhm,
We've had to shift our priorities. And I have
mhm,
to raise my kids like that too. My son wants to be a lawyer and they want to do all these things, and making money is their biggest goal. And I have to tell them that that is not a goal. That's not a reasonable goal for kids or adults. We have to reshift our priorities. And if your priority is not all the things you mentioned, the
mhm.
lifestyle changes, those are the people that I'm seeing are really sick.
Yeah,
And don't wait until you're really sick to make those adjustments.
yeah. So one of the things I teach people is, if there's that saying, it's one of my favorite sayings, if you fail to plan, you plan to fail. And we are busy. We have kids, we are working, we are like, maybe you don't like work for money, but maybe you're volunteering up at the kids' school. Maybe you're supporting like carpooling or whatever. So we all have a million things to do all the time for the most part. And for me, every morning I look at my schedule because it's different every day. I don't always have the same class schedule or whatever, or kid schedule, depending on what the kids' activities are. And I say, okay, I have a 20-minute break here. I have a 5-minute break here. I'm going to go spend 2 minutes in between calls out here outside, right? And I
And what am
have
I going
to,
to do? And what can I say no to?
yeah.
You know,
Oh, they know it's the best,
right?
best thing. Like, sorry, but that doesn't work for me. It's one of my favorite things.
Mhm.
But you have to purposely schedule it in. Like I do, or the day will go by, I'll be like, oh, no wonder I'm so tired. I didn't do
Yeah.
anything. I didn't take care of myself today. Even it's literally just two
Just a couple
10-minute
minutes.
breaks.
Yes,
That's that.
exactly.
It doesn't
Exactly.
have to
Yeah.
be
Yeah.
crazy
Not an
expensive.
hour. Yeah. Let's be
No,
realistic. Yeah.
no, I mean, 2 10-minute breaks, one mid-morning, one mid-afternoon is so
Yeah.
restorative, but
Yes.
you have to schedule it in,
Yes.
or it's typically no one, I don't know a single woman out there that's sitting around, binge watching Netflix, eating bonbons every day, all day. Like, I don't. We all have
Mhm.
things to do, and we're doing them, but that
We're doing
self-care
too much. A lot
has
of
to be
us are
done.
doing too much. Yeah,
Yeah. So one of the biggest things I see too is being, as far as initiating that massive stress response, is being overscheduled.
for
And
sure.
like there's people, like for me, that is the biggest thing that will set off my adrenal, like my adrenals will tank if I don't
Mhm.
give myself buffer. So like
And this includes exercise too. Please,
oh
like
yeah.
there's so many women and we're trying to lose weight and do the right thing and I see, yeah, exercise can be overdone. So let's just call it movement. I like how the walk, you know what?
Mhm.
Yeah, there is a time and place for all of that, but when your body is stressed, exercise is more stress adding on. So let's just,
Yeah, like the ones who are doing like, I'm doing hot yoga and CrossFit, and then and I just feel terrible afterwards. I said, your body's telling you that you're doing too much. It's too
yeah, yeah,
intense.
right.
um, but it's one of the things I teach my mom clients is you have to schedule in buffer. You can't go right from work to dinner to kids to bedtime and do that over and over and over and
Right.
over again. You have to build in some buffer in your day, or being overscheduled, or be like, no, I'm not going to volunteer for the PTO this year.
Yes.
No,
Yeah.
kid, you can only do 2 activities each
And I
semester
was
or
going to
whatever that
say,
is.
yes, say no to adults, but say no to the kids too. We are also raising this generation that's never been told no, gets everything they want. We are creating monsters. That's
Well, and they
another
don't
one
even know how
of
to
my
be
pet peeves.
bored.
And they
We're
don't know how to be exactly
we're
or self.
taking that from them.
And we're
That's a
saying,
boredom is a
yes,
gift.
yes.
We're
My kids,
taking it
when they
away.
say they're bored, I say, good,
Yeah,
congratulations, you've gotten
I
to the
know.
point. Stare
Yeah.
outside now, I mean,
Now you
go
can be
outside.
creative.
Yes,
We're taking the gift of boredom, because that facilitates, like, oh, maybe I'll do some art. Maybe I'll
mhm,
go play outside
yes,
and build a tree fort.
yes,
Maybe I will write a song. Maybe I'll learn an
yeah,
instrument. We're taking boredom as a
yeah,
gift for children to
yes,
really figure out who they are, and what they're talented at.
yes.
If like we're like terrified of them being bored, which I'm not, like, good.
No,
What I
good.
say is like, gosh, I would love to be bored. That sounds great.
Mhm.
They don't like it when I say that, but I say it. But I think as adults too, it's not just for kids. Like, think about it. If you're listening to the live, or if you're listening to the replay, when was the last time you took the time to, you know, do
To be
something
bored.
just to be
I mean,
bored, and
honestly,
or to do something that just delights you, just
yes,
utterly fills your soul, makes you feel connected, delights you, makes you feel alive and energized, whether that's playing an instrument, learning a new hobby, like whatever that looks like. And I think what happens is, when we get into that stress-based tunnel vision, we're overwhelmed, we're stressed, we're busy, we're just all the time. First thing to go is rest and play, because we don't have time. We're too overwhelmed. We're too busy. And those are the very things that are going to get
it's
you out
needed.
of that. And
Yes,
I think that it is such an underrated modality of healing your body,
yes.
is to say no, to bring in some boredom, to do things that light your soul up
Every day. That is
every day.
everyone's assignment. Every day.
Yeah.
Every day.
Yeah. So one of the things Lindley taught me was to create what's called a self-care buffet. So just like you can be thinking of all the restaurants you want to go eat at, and then as soon as someone says, hey, where do you want to go eat? You go, I don't know. Right. So oftentimes when you're stressed out or overwhelmed and you need to participate in a self-care activity, it can be hard to think of one in the moment. So she teaches people to create this buffet of low energy, medium energy, and high energy tasks. Rest and play, coping, basically. And to check in with yourself in the morning, put it on your bathroom mirror, put it on your fridge, put it in your closet door, whatever, and say, okay, what's my energy level like today? What would be really restorative for me? Is it a dance party with the kids, which would be high energy? Is it low energy of like, I just need to go lay in the sun for 15 minutes? What does that look like? Choose, and then like you have your tasks already listed. Pick one. Where is a 15-minute window in my day when I can do this thing that I know will restore me? And then do it. you know and it's one of those things, like, until you maybe have seen that or heard of that concept, you might not think of even doing something like that.
Mhm.
But it's
So
so
good.
important. Oh my gosh, this is so much fun. We could just do this like all dang day.
Great.
Talk about all these things. So I would love to kind of shift over a little bit into women's hormones,
Mhm.
because I think there are a lot of myths and misconceptions out there with things like hormone replacement therapy, and that there's so many women who are suffering needlessly, who are
Yes.
going through extreme perimenopause symptoms, extreme menopause symptoms. And my methodology is to restore nutrient deficiencies, reduce stress, reduce toxins, figure out what's driving inflammation, what's driving estrogen dominance, or whatever it may be, the variable there. Um, but at the same time, like I preach against medical band-aids all the time. I don't look at HRT as a medical band-aid. I look at it
No,
as
it's
like
support. It's
support, right?
supporting normal
And
process.
but I
Yes.
think a lot of women might think of it like that, like, oh no, that's
Yes.
just medication. I don't want to do medication. I don't want to be stuck being on something. It's
Mhm.
my whole life. And to me, that's not at all what HRT is. So can you kind of
Right.
maybe give us a little lesson on, the purpose of it, how it
Yeah,
helps the
great.
body?
And this is exactly how I talk to my patients too. There are hormones from Walgreens and CVS, which are synthetic, man-made hormones from horse. First of all, we should not be taking any animal type derivatives, right? That's the problem right there. So when people are being told to take hormone, they're being told most of the time to fill their prescription of hormone at CVS, Walgreens, and that is the synthetic stuff. So that is medic. I don't even call it hormone. That's medication.
Yeah.
Bioidentical, which I didn't even know was a thing. I never heard. What is bioidentical? Hormones are hormones. So now we do have to call them bioidentical. They come from a compounding pharmacy, clean pharmacy. These are plant-based hormones that when you look under the microscope, match identically to the T to what is in your own body.
Mm-hmm.
So if you are going, number one, if you're going to take hormone, please take bioidentical, clean hormone. That's you are replacing what has been needed, what your body has been producing, on and on. The other thing I do want to say is, why are we waiting to even offer a woman hormone until they are suffering with menopausal symptoms? To me, this is like telling your child, get a job when you have $0 in the bank. Why wouldn't you kind of prepare the perimenopausal state 10 to 15 years prior to those menopausal symptoms? I guarantee if you're at age 35 to 45, you're having some sort of hormonal imbalance. You are having a deficiency. And that could be, I mean, the list is so long,
Yeah.
right? But if you are in the ages of a female between 35, 45, check in with yourself, with a practitioner. And if any of those vague symptoms you think they are hormonally related. So I teach my patients, I use the monthly flow chart, right? We will look at symptoms of estrogen, symptoms of progesterone, when they are produced in the cycle, what is a symptom of deficiency for each hormone, and we can then, knowing that, treat in certain phases of the cycle while we are still cycling. That's also another myth, is you may not take hormone until you are done cycling. Not true. Again, I'm not waiting until we reach 0.
Yeah.
That's when you need a lot. My patients, perhaps, again, that bracket, age 35, 45, why couldn't they take hormone every 3 days, once every 5 days? My patients are educated on checking in with their body, learning the signs of deficiency, and then treating with the hormone on that day of the cycle. And they probably will need treatment every 2 days, every 3 days, not twice a day yet. And we slowly, to me, that is a smooth transition. That is a smart transition from perimenopause into menopause. And menopause is when we need to replace that hormone, not for cosmetic reasons, for internal organs. Our brain, our bone, and our cardiovascular system require organs. Because if we say chronic disease is a disease of older age, it's because of a loss of hormone. And we can go on and on. Diabetes is related to low testosterone. Osteoporosis is associated with low estrogen. Alzheimer's related to low estrogen.
What about all the women who are like 45 with frozen shoulder?
Right.
Women, there's a reason for that. It's got a link to your hormones.
Yes, we do. And we don't need to get pellets. There's so many people doing, we need to have the hormones in balance. When you're doing pellets, you're doing one, you're not doing all of them. And your job, which is so foundational, you're kind of indirectly treating hormones. You realize it, but the patients may not. Every time you fix the gut, every time you take adrenal support, when your ovaries stop working, when your ovaries stop producing hormone, your adrenals take over. So I don't tell every woman needs to be on hormone replacement. The women who have nicely functioning adrenals will still get a little bit of hormone output. And so that's the balance that we want to achieve. But just knowing that no one's had that conversation, no one's had that education. I give the power and the education to my patients. I don't want them to be overwhelmed. We discussed that. I mean, if you're overwhelmed, then we have to take a step back. But all of my patients get to the point where they understand symptoms of excess and deficiency of every hormone. They have all the hormone at their disposal, and they know when to take, what to take, and how much to take, because every woman is different.
Yep, absolutely. Now, there's kind of two, when there may be women watching who think, well, I've asked my OB to test my hormones, or my OB-GYN, and they say, no, it's not necessary. I can't tell you how many clients come to me with severe hormone imbalance and said, I asked, I advocated, I begged my doctor to test my hormones, and they said it wasn't necessary. I'm like,
Yeah, they either say it's not necessary because they don't believe in hormone replacement.
right.
It's still old school thinking that hormones cause cancer. Perhaps it's the horse derivative that causes cancer, not the hormone piece. So that's out the window. Or I do get the same patients you do, and they say, well, I was told that this is normal for post-menopause. Yeah, and the level says 0, but so is diabetes now becoming the norm, and so is Alzheimer's becoming the norm. But that is because you don't have the hormone. I want to replace you to a neutral level, not to fertility levels. And now we're getting side effects.
Right.
They say you just need about 30% of the hormone level of what you were when you were cycling to protect your inner organs. That's where we need to be.
Yeah. And, for me, and I even I wasn't proactive enough in this, like with, so I had, for those of you listening, a life-threatening condition with my last child, which is called placenta accreta. And so as a life-saving procedure, I had what's called a C-hyst, which is a C-section followed by immediate hysterectomy. I was 39 years old at the time, and I kept my ovaries, but without the uterus, my ovaries just never percolated back up. Also combined with the age I was.
You guys need more. So any woman out there with hysterectomy actually needs more hormone. They have documented that.
Yeah. And so, but I tried for a long time to kind of primarily work at, really working in my gut and inflammation and talking, and that's good. It's good and it's important and it's necessary. But what I didn't do as early as I wanted to,
there's no replacement for hormone.
Yeah. What I didn't do as early as I should have done for myself, was to actively just, I'm like, it's time. It's time to get some of that hormone support. So you can do blood work to check your hormones. It doesn't have to be super pricey. And I've done that. There's also a test out there called the Dutch test, which looks at your adrenal function as well as your hormones and their pathways. It's a more detailed test. It's also a more expensive test. But if you want to get your hormones tested, you can. You just haven't found the right person yet if you've been denied. And there's a lot you can tell from symptom presentation and patterns and, symptom clusters and all of that. But, it's so frustrating to me because as a human being, if you want to get your hormones tested, especially as a woman, like you should be able to get your hormones tested.
There's hurdles everywhere.
Why are you being told no? No.
Not only that, I always tell my patients, I'm not going to be the hormone pusher. However, if we meet for 60 minutes, you tell me all your we go through all the things. I will give you hormone on that day without even testing you. I know your symptoms. I will do testing. Your practitioner really should be doing hormone testing, to make sure we're not overdoing the hormone levels. So I will do that. But we come to an agreement with the patient and I, but hormone testing is out there. Hormones are out there. And actually, we give a shout out to all of the compounding pharmacists out there that are willing to help and will also point you in the right direction and make pure, good, healthy, bioidentical hormone every day.
Yeah. Yeah. So I think really, the kind of to summarize this conversation is you aren't stuck where you are. You don't have to be miserable. You don't have to live with chronic symptoms. There's always something you can do. It's never too late to make a difference in your health and wellness and in your symptom presentation. And there are people like Theresa, like myself, out there who have a deep desire to serve our clients and our patients and provide the type of support that you haven't necessarily found somewhere else. So I know that Theresa works, you do telehealth too, like all over the, if you're in the state of Texas, right, you can serve those people. I work with clients all over the country, but I'm also not prescribing medication. So I think when you prescribe, you have more parameters there. But I think that I would just like to encourage you, if you're watching the live, if you're watching the replay, and you have felt kind of stagnant or plateaued, and you're not making the improvement that you want, don't give up. Don't give up. There's help out there. There's HRT, there's testing, there's
So much. There's so
lifestyle
much.
shifts that are free.
Yes.
There's all sorts of options available to you. So I know there are still a few people hanging on to the live with us. Let me see who is here with us. So that is Lori, and then somebody who I just see a phone number. But if you want to pop in and unmute yourself and ask a question, I would love to just give a few minutes to see, and you may not have a question. You may have answered all your questions, probably not though. That there's no stupid question. Like, all questions are valid and wonderful, and we are here. I think both of us have this deep desire to guide and educate, and to where you have a deep understanding of your body. And that starts with questions and conversations. So, Lori and whoever else is on here that I I have no idea what your name is. If you have any questions, one, you can unmute yourself and actually ask that, or you can even, type your question in the chat, and I'll check that chat. So, as we kind of wind down this call, would love to give you that opportunity. And if you don't, that's okay too. You can also, if you saw the advertisement or the event page, you can message me. I'm sure Theresa would be fine if you message her with anything like that. Like, please
Absolutely.
utilize us. So if you're maybe like not sure if you want to ask a question publicly, I totally understand that too. So reach out to either of us.
Absolutely. The last thing I will say, because this has become quite frequent in our local area, at least. I don't know if things are changing in the state, and I will just kind of skate by it really quickly, but I let all the moms know we are a vaccine choice office. We are family practice. I will never discharge a patient or not accept a patient based on your vaccination status or choice. So I think that is really important, because a lot of practices in our local area have made different decisions and are letting children go, and we are here to welcome them. So
Yeah.
I'll just say
Yeah.
that.
And I definitely want to highlight that as well with Theresa. Is Theresa doesn't just see women for HRT. You see everybody, right? I mean, you see children, you see men, you see like whole families. And I think whole families, I was talking to somebody last night at the school event for the kids who's like, I'm shifting my whole family over to Theresa, and so it's nice to have one practitioner who works with everybody in the family. You don't have to go to 5 different people, and you can get that cohesive, level of support. So, whoever you are, I'm just going to call you 512. Okay, here we go. It's not letting me unmute. Oh, you know what? Let me see if I can ask you to unmute, Lori. Hold on. Let's see. Ask to unmute. I can't unmute for you, but I'm hitting the button that says ask to unmute. So I don't know why it's not. But let's see what the chat says here too. You can get your question asked that way. It's not letting me. I don't have any questions. I hope y'all are going to be at Evo Meds Picnic at Silker Park on
We'll have to
June
look it up.
5th. I'm flying from Nashville. Oh, that's cool.
Let's look it up.
Yeah, well, I'm gonna write this down. So Evo Meds Picnic. I love picnics. At Zilker Park, 6'5".
Oh, there she is.
Oh, she caught me.
Well,
She.
yeah.
Oh,
Is she
hi. There you are.
Yeah.
Hello.
We're going to look that up.
Yeah. So you live in. So you're not local to. You're not in Texas. You live in. You said you live in. Was it Tennessee? Yeah. Okay.
We can't.
Awesome. Well, it would be so fun to actually see. I love the virtual world. I love the telehealth world because it really opens up who we get to serve. But there is just nothing better than seeing people in person. It's just there's just something extra special about that. Well, Lori, I appreciate you, joining us live, and I think the more people that have this type of understanding about what is available, what you are capable of to change your own health, I think one of the cool things about women is that we share. We take our knowledge, we take our experiences, and we share with our moms and our friends and our neighbors and our, whoever we're, in there in our lives that we come across, and that we get to spread that message of hope, of healing. And it's a message I think that more people, need to hear. So I appreciate you, that you joining us, and thank you. It's been so much fun just to have this random rabbit trail conversation with Theresa. So we really and truly mean it. So if you watch live or if you are watching the replay, like reach out to us. You can find me. My website is holisticobsession.com. There are buttons all over that website that says book a free connection call. It is literally a Zoom call that allows us to have a free 30-minute conversation. And oftentimes that's the best place to start because I will see you, I will hear you, I will believe you, and you'll leave that conversation already with more information about potentially what's going on with your body. And I just to like put it out there, I'm a functional diagnostic nutrition practitioner. I'm not a licensed doctor. I'm not a licensed nurse practitioner. I don't prescribe. I don't treat disease. I don't diagnose disease. I work more about the kind of root cause, inflammation, toxin imbalance, pathogen level, where we're looking at root causes. But what I love about Theresa, she also does that, but she also has the capacity and ability to prescribe and like that HRT and to work on, a different kind of level than I do. So, both of us would be extremely happy to just have these conversations with you. And if you have a question about anything we've covered today, find us on social media. Find us. So Theresa's practice is called Family First Functional Medicine. Is it Bee Cave or Lakeway? Because there's no where's the border? I don't even know. Where's your actual?
It is Bee Cave.
It's Bee Cave.
Probably
Okay.
just rent prices are higher.
Okay.
That's
So,
all.
nice. I'm like, where's the actual border there? So you can find her at Family First Functional Medicine, Bee Cave. If you anywhere in Texas, she can support you via telehealth. And she's absolutely phenomenal, and you cannot go wrong by working with her. And she's just fun and delightful. And here's the other thing that I always say is getting healthy doesn't have to be clinical. It doesn't have to be stuffy. It doesn't have to be pointing my finger at you. It doesn't have to be judgmental.
It'll be a friendly conversation. It'll be
Yeah,
a friendly conversation and a lot of education, advocating for you. I mean, my patients do the hard part. I'm just here as their partner.
exactly.
So
Exactly. So
thank you for hosting and thank you for
absolutely. We
always
should
putting
do this
this
again.
out there. It would be great.
Yeah. So I'm going to hit the stop record button, and we will see y'all next time.